At Pharmacy Investigators and Consultants, we are really excited about our new proprietary system called COPS. What COPS does is it allows health plans to go through the millions of claims that they get on a daily basis and figure out quickly and efficiently which ones are fraudulent and which ones are not. And COPS is kind of a play on words. Just like the beat cop that walks the street and looks at thousands of people a day and tries to figure out which ones are the good guys and which ones are the bad guys, COPS does the same thing for health plans. The COPS software looks at claims data and determines inappropriate relationships between physicians, pharmacies, and patients. And once we've identified those inappropriate relationships, we can then bring in additional information from social media, such as Facebook, LinkedIn, Vine, Twitter, to see what those folks, those relationships are saying about each other. From there, we can determine if true fraud is actually happening, and then that provides an entire package for an investigator to be able to use that information in their investigation. So what do we mean by inappropriate relationships? Well, a typical pharmacy will have claims from a variety of physicians in their neighborhood, right? So if we saw a pharmacist that had only one or just a handful of physicians prescribing for that pharmacy, it would be an inappropriate relationship because the claims disbursement should be pretty much similar to the physicians in that community. So if there's 50 physicians, but that particular pharmacy only has 5 physicians submitting claims through, we know there might be probably problems there. There might be fraud there. For example, we found in a case study, we looked at 60,000 pharmacy claims within a 2-week period. We were looking at those claims for co-conspiracy schemes, and we looked at 5,000 pharmacies within that 60,000 claims, and we very quickly came up with 37 suspicious clusters. And then once we had those 37 suspicious clusters or inappropriate relationships, we brought in the social media information from Facebook and Vine and LinkedIn. We could see where these 37 were further reduced to 15 that were actually committing fraud. This helped our client by, instead of going to 37 pharmacies, narrowed it down to 15, and that saved them a lot of time and money, and we were able to recover from that situation for our client.